Hello, my name is Dr. Manish. I am a pain management specialist or pain physician. So today my topic is on low back pain, and in the previous video I talked about the overview of pain, how it can be assessed and managed properly, and today the lower back pain, which is a very common phenomenon in most of the adult populations and very distressing to some patients and leading to functional inability. So what is low back pain and how it can be treated? So lower back is basically between the lower part of the rib cage and going up to the mid thigh, and this is the area where there are multiple sources of pain which has to be taken into account whenever we take in history and also assess the low back pain area. So whenever low back pain we talk about, there are two types of joints. So this is a model of the spine along with area of the pelvis. So low back pain can start from two areas of joints whenever see. So these are the vertebrae in our body, and between the two vertebrae there is two joints. One is the facet joint between the one vertebra and the second. So this is the area of the facet joint. This can be a source of pain. Second joint which is there between the vertebral body itself, that is the disc. This is not a joint properly, but this is the disc which is the source of pain. So whenever there is a discogenic pain, this can be degenerated, which is because of the age or because of the posture, because of the occupation, and because of the degeneration of the disc itself, it can lead to discogenic pain, which is a low back pain without any radiation, localized in the midline region. And this is the small white areas which is the disc. And whenever there is a facet joint pain, this is the side of this is the midline, this is the side of the back, these are two sides. The pain will be in the two sides of the body and without some radiation to the legs. And after that there is another joint which is the sacroiliac joint. This is the sacroiliac, this is the pelvis, this is our lower back, this is our waist, and between the waist and the lower back there is a joint. So this is the sacroiliac joint, and this joint also gets strained because of repeated exposure to the activity. So these are basically anterior posterior joint. This is the posterior part, this is the anterior part of the joint. And whenever there is sacroiliac joint pain, there will be pain in the lower back and it might radiate to the buttocks. And particular performing some tests, we can diagnose the sacroiliac joint pain in most of our patients. Third is, other than the joints, there may be other sources of pain. What are the other sources? It may be a neuropathic pain. So these joints, whenever the disc that I told about, the disc might get prolapsed. So whenever the disc gets degeneration, there is a discogenic pain. After degeneration, there is a long-term process when the disc gets prolapsed backwards. Whenever sometimes we lift up some heavy objects, or whenever we fall down and have the disc displaced, and the disc can go posteriorly, compressing on these small yellow nerve roots. These are the nerve roots. Whenever the disc gets compresses the nerve roots, these nerves actually carry the sensation from the lower limb, and this can lead to some radicular pain, low back pain, and radiating to the lower legs up to the feet. So this can be a cause of sciatica. It is known as sciatica, and known as a herniated disc or prolapsed intervertebral disc. This can lead to low back pain with leg pain. Another area of the lower back region where the pain can originate is the muscles. So there might be paraspinal muscle spasm, which is quite common in some patients post surgery also, and it can lead to some kind of lower back region pain without any radiation. And there can be piriformis syndrome. So there is a muscle related here in this back region in the buttocks. This is the key muscle of our buttocks and whole. So this piriformis muscle can also get compressed, because piriformis muscle is called a piriformis syndrome. There is a large nerve which goes below it, and that is called sciatic nerve. Whenever piriformis muscle is tense or it is under strain, it can compress on the sciatic nerve, and it can lead to kind of a pain which is radiating to the lower to the legs. That is called pseudosciatica, and it can be related as piriformis syndrome. This is also a lower back region pain. And other areas where the pain can originate is the ligaments. When the ligament hypertrophy is there are multiple ligaments. These are basically from one structure which is attaching one bone to another. So those ligaments can lead to hypertrophy, and that can lead to lower back pain region. So ligaments, joints, muscles, and disc, these are the very common areas where the pain can originate. And also there are some small muscles which are present along the side of the vertebra, whose when we do exercises, particular form of exercises, these help to tense those muscles and help to relieve the pain also. So I will come to that later. So these are the common areas of low back pain which has to be taken into account. One is the discogenic pain, one is the prolapsed intervertebral disc, third is the facet joint pain, fourth is the sacroiliac joint arthropathy, sacroiliac joint pain, and the piriformis syndrome. So these 5 areas are quite common. Other than that, ligament hypertrophy can be a cause of pain. So these are the sources, and we try to we examine his taken history, and say what are the aggravating factors and the relieving factors, and then we come to the diagnosis by examining you. After the examination, we give some test, basic x-rays, and if required, some MRIs. And if there is no neurovascular deficit, if like you don't have any neurological issues, like you don't have any motor weakness, you don't have your bowel bladder habits are within normal limits, then we can go for some basic medications and physiotherapy. After initial part of medications in the form of pregabalin, gabapentin in titrated doses along with nortriptyl and duloxetine, which are the anti-neuropathic agents in case of neuropathic pain. And after observation of 2 weeks or 3 weeks, we give some exercises which are depending on the particular source of pain, spinal exercises, extension or flexion, and we try to control the pain in that manner. Whenever there is a pain in a 100% pain scenario, 60 to 70% is relieved with all these measures, and 20 to 30% remains, but your functional ability increases. That is the target of our therapy. And if with medications this pain is not getting subsided, we go for some interventions, and I will come to the interventions in our next videos, which involves a facet joint injection or any nerve injection, neuropathic pain for that, sacroiliac joint injections and piriformis injection, and also we can go for an epidural injection for the neuropathic pain, which is the radicular pain. So these are the interventions which can be given in particular scenarios so that the pain can be relieved and your functional ability increases. And in case of red flag signs, whenever there is a neuropathic pain along with weakness of the legs and severe inability to walk, in those cases we go for opinion of neurosurgeons, and the surgical opinion is sought and surgery should be done in those cases. So this is the area of low back pain, which is a very common phenomena. And the take home message from this video is, whenever you are feeling a pain which is persistent for 3 months and limited to the lower back region going to the legs, even after surgery, even after a spine surgery 1 or 2 years have been gone and then there is some pain, you can now consult a pain physician, and rather than going to a pharmacy and taking some over the counter drugs, and after the proper assessment and localization of the pain, we can actually plan how it can be managed so that you can come back to your daily life smoothly and don't have any suffering. So that is our target. Thank you. Stay blessed.